COVID-19, coronavirus disease 2019, is an infectious disease caused by severe acute respiratory syndrome coronavirus 2. It was first identified in December 2019 in Wuhan, China, and has since spread globally, resulting in an ongoing pandemic. As of 16th May 2020, more than 4.56 million cases have been reported across 188 countries and territories, resulting in more than 308,000 deaths. More than 1.64 million people have recovered. Common symptoms include fever, cough, fatigue, shortness of breath, and loss of smell and taste. While the majority of the cases result in mild symptoms, some progress to an unusual form of acute respiratory distress syndrome, that is ARDS, likely precipitated by cytokine storm, multi-organ failure, septic shock, and blood clots. The time from exposure to onset of symptoms is typically around 5 days, but may range from 2 to 14 days. The virus is primarily spread between people during close contact, most often via small droplets produced by coughing, sneezing, and talking. The droplets usually fall to the ground or onto the surfaces rather than traveling through air over long distances. Less commonly, people may become infected by touching a contaminated surface and then touching their face. It is most contagious during the first 3 days after the onset of symptoms, although spread is possible before symptoms appear and from people who do not show symptoms. The standard method of diagnosis is by real-time reverse transcription polymerase chain reaction from a nasopharyngeal swab. Chest CT imaging may also be helpful for diagnosis in individuals where there is a high suspicion of infection based on symptoms and risk factors. However, guidelines do not recommend using CT imaging for routine screening. Recommended measures to prevent infection include frequent hand washing, maintaining in physical distance from others, quarantine, covering coughs, and keeping unwashed hands away from the face. In addition, the use of a face covering is recommended for those who suspect they have the virus and their caregivers. Recommendations for face covering used by the general public vary, with some authorities recommending for them, some recommending against them, and others requiring their use. There is limited evidence for or against the use of masks in healthy individuals in the wider community. According to the World Health Organization, there are no available vaccines nor specific antiviral treatments for COVID-19. On 1st May 2020, the United States gave emergency use authorization to the antiviral remdesivir for people hospitalized with severe COVID-19. Management involves the treatment of symptoms, supportive care, isolation, and experimental measures. The World Health Organization declared the COVID-19 outbreak a public health emergency of international concern on 30th January 2020 and a pandemic on 11th March 2020. Local transmission of the disease has occurred in most countries across all 6 WHO regions.